So I want to go over this paper that was in the JAMA Internal Medicine Journal, which is estimation of excess deaths associated with COVID-19 pandemic in the United States from March to May. So this is old, came out July 1st, and the data that it's going over is from March to May, and obviously we have gone through pretty much May, June, yeah, we've gone through 2 full months ever since the data collection for this particular paper has been number crunched. Regardless, you may have heard that the U.S. government is actually, lying about COVID numbers, or we are telling doctors to list things as COVID deaths when they really aren't actually COVID deaths. So we're actually hearing that we are trying to boost up those death numbers in order to get some sort of political change accomplished, or some sort of regulatory change accomplished. Some people might argue that it's to get particular people out of office, or that we're trying to move towards a more what would the word be? We're moving into a more fascistic regime by using COVID deaths as a bargaining chip to enact that type of change. So what I'm going to argue is the exact opposite is happening. The exact opposite is happening. The government is not trying to boost the death numbers because, well, for one, that looks bad on the government, right? To have your own citizens die is not good. And even if it is people who have pre-existing conditions, or people who are viewed as older or weaker, that's not necessarily a good thing. Or I should say, politically wise, it is not good to just say, yeah, we're just letting all of our old people die. That is one of the worst political maneuvers that can be done. So what is probably more likely is that the governments are trying to suppress the actual death numbers and trying to make it so that it is harder for someone to be listed as a COVID death. Maybe they can find any other pre-existing condition to do so, and if they can, then they're going to list that on the death certificate, or they're going to list that on their medical reports. And when we do the number crunching at the end of the weeks, then at the end of the day, then the government can say, look, our death numbers are going down, therefore we are successful at maintaining or controlling this particular virus, okay? So that is what I think is much more likely to happen. That is the direction that a government is going to lie. Historically, governments will lie and say that there is less death and destruction than there actually is, unless it's an enemy, right? But if they're talking about their own people, governments always lie or downplay the severity, because the more death there is, the more it reflects poorly on the government. So I want to go over this particular paper, and I'm just going to go read through the key points and the abstract, and then maybe the results. So this is going to lead credence to my belief that the governments are lying of how bad it is, and they're downplaying the severity of the virus because they know they screwed up royally. So, estimation of excess deaths associated with the COVID-19 pandemic in the United States, March to May 2020. So, key points. Did more all-cause deaths occur during the first months of the coronavirus disease pandemic in the United States compared with the same months during previous years? So this is the question. Is there an increase, or is there an excess number of deaths that is showing up as a result of the pandemic that we did not see earlier? So here are the findings. In this cohort study, the number of deaths due to any cause increased by approximately 122,000 from March 1st to May 30th, which is 28% higher than the reported numbers of COVID-19 deaths. So what we're saying here is almost a third. We have our number associated with COVID-19. That number, take a third of that and add it to that COVID-19 number, and that's about what you're going to get, or that's about the number of excess deaths that we're seeing right now. Now, one could argue, okay, well, is this really serious? Like, how much or how big are these, what would the word be? These excess deaths, like, how serious is it, right? Like, what proportion is it? So, meaning the official tallies of death due to COVID-19 underestimate the full increase in deaths associated with the pandemic in many states. So, granted, deaths associated with the pandemic might not necessarily mean that people are dying from the disease. They could be dying for unrelated reasons, such as when all of your medical staff are focused on treating everyone with the disease, there could be someone else who has a completely different disease that is not able to get the treatment that they need at that time. Or there's some people with, say, preventative diseases or preventative illnesses that would normally go through multiple steps of preventative care to prevent complications, but since the medical staff are overwhelmed, it could be that that patient is not going to receive all the time and care that they need in order to survive, or at least to avoid complications, and then as a result, they get complications down the road, and those further complications end up resulting in death. So that could be another part of the pandemic that we're not even considering, right? We're not even considering that other aspect of death, or that other cause of mortality, okay? So what we're saying here is that the case fatality rate for the virus in of itself might undercount all the deaths that are associated with it. And granted, that I don't think that that's the main cause right now, because I think it is mostly from actually contracting the disease, not from the complications of different diseases. I think that our medical system has still pretty much kept up for the most part. Now, granted, a lot of ICU capacities at a lot of Texas and Floridian hospitals are full right now. That is true, but elective surgeries and a lot of other things are still, I believe, are still going on. So I don't believe that it is just that. I do think that it is mostly the disease is killing more people, and the governments are trying to prevent the public from being fully aware of how bad and how serious this is actually going to be. So, here's the abstract. Efforts to track the severity and public health impacts of coronavirus disease in the United States have been hampered by state-level differences in diagnostic test availability, differing strategies for prioritizing of individuals for testing, and delays between testing and reporting. So, like, the United States did not get their crap together, and now we have this cobbled mess trying to basically quantify how pervasive is the disease in our society. And this should have been taken care of in January. Here we are in July, and late July, and we're still dealing with a hobbled mess. Anyways, evaluating unexplained increases in deaths due to all causes attributed to nonspecific outcomes such as pneumonia and influenza can provide a more complete picture of the burden of COVID-19. So this is what I like to see. Just look at the excess deaths, and that should give you a comprehensive understanding of what's going on. And you can see these spikes, at least on a local level, of excess deaths in certain locations. And then when you see those spikes, you can then say, that spike is correlating, at least, with the COVID-19 spike. Therefore, those spikes are probably the same, one and the same. It's just one is proportionally smaller because what would the word be? Because you were not able to track and find all the deaths. So this design used the observational study evaluated numbers of U.S. deaths from any cause and deaths from pneumonia, influenza, and or COVID-19 from March 1st to May 30th, using public data of the entire United States population from the National Center for Health Statistics, or NCHS, and these numbers were compared with those from the same period of previous years. All data analyzed were accessed on June 12, 2020. So, Here's the main outcome. So increases in weekly deaths due to any cause or deaths due to pneumonia, influenza, COVID-19 above baseline, which is the average, which was adjusted for time of year, influenza activity, and reporting delays. These estimates were compared with reported deaths attributed to COVID-19 and with testing data. So there were approximately 781,000 total deaths in the United States from March 1st to May 30th. Okay. This is representing 122,300 increase or excess, more deaths than would typically be expected at the time. And this is the prediction interval, or I should say 95% prediction interval is from 116,800 to 127,000 more deaths. And this is to account for the variation in the baseline, right? So there were 95,235 reported deaths officially attributed to COVID-19 from March 1st to May 30th. The number of excess all-cause deaths was 28%, higher than the official tally of COVID-19 reported deaths during that period. In several states, these deaths occurred before increases in the availability of COVID-19 diagnostic tests and were not counted in the official COVID-19 death records. There was substantial variability between states in the differences between the official COVID-19 deaths and the estimated burden of excess deaths. So here's the conclusion. Excess deaths provide an estimate of the full COVID-19 burden. Oh, and yeah, so you know what? I'm going to leave it at that. I went through the results already. So yeah, don't trust the government. They seem to be very shady right now. So just know to protect yourself. Try to avoid contracting this disease if you can, and hopefully we will be able to get through this if we all work together, right? Power of friendship. Anyways, thanks for watching, and hopefully if people end up bringing, okay, so this is the reason why I wanted to do the video. So if people end up bringing up, oh, the government is just trying to boost up the COVID-19 deaths by adding COVID-19 to their death certificates, and they died from something completely different, just tell them, no, the excess deaths that we're experiencing right now is much higher than what the official COVID-19 tally is. The government's lying in the other direction. And there's pretty effective propaganda to make people believe that the government is doing it in the opposite direction, right? So if you can get people to believe the opposite, the exact opposite, then you succeeded at making effective propaganda, right? And I heard that now it's even worse. Like the excess deaths are no longer, I think they're reaching 200,000 for the year now, so absolutely insane. I haven't actually seen that paper, so don't quote me on that, but just know this is bad. This is bad. Anyways, thank you for watching, and hopefully I will see you tomorrow.